Hello friends, welcome back. My name is Dr. Vijay Bhatia. Today I'm going to talk about somatoform disorders. This is a series of mental disorders. Somatoform disorders. The main feature is repeated presentation of physical symptoms together with persistent requests for medical investigations. In spite of repeated negative findings and reassurances by doctors that the symptoms have no physical basis. If any physical disorder are present, they do not explain the nature and extent of the symptoms or the distress and preoccupation of the patient. Persons with these disorders may also show a degree of attention-seeking behavior, which is histrionic behavior. They will do anything to seek your attention, particularly if they are frustrated by their failure to persuade doctors of the essential physical nature of their illness and of the need for further investigations or examinations. So they keep on asking the doctor. If not one doctor, they will go to the other doctor. If not that doctor, they will ask for specialist. If not specialist, then they will go to the local healers. One of the form of somatoform disorder is a particular type called somatization disorder. There must be a history of at least 2 years, complaints of multiple and variable physical symptoms that cannot be explained by any detectable physical disorders. Any physical disorders that are known to be present do not explain the severity, extent, variety, and persistence of the physical complaints or the associated disability. If some symptoms clearly due to autonomic arousal are present, which will be the symptoms of like anxious or anxiety, like heart is racing or sweating and muscles getting tense, they are present. They are not a major feature of the disorder in that they are not particularly persistent and they are not distressing. Preoccupation with the symptoms causes persistent distress, that is the main feature, and leads the patient to seek repeated 3 or more times consultations or sets of investigations with either the primary care doctor or specialist doctor. In the absence of medical services within either the financial, if the patient cannot afford to keep on going and paying privately for these services, or they have physical reach of the patient, there must be persistent self-medication. So for whatever reason, if they can't afford financially or if they are too far away, the person will not stop. They will continue to seek some kind of relief for themselves, either with self-medication or multiple consultations with local healers. There is persistent refusal to accept medical reassurance. No matter how many investigations and examinations have been done, there is persistent refusal to accept them, that there is no adequate physical cause for their physical symptoms. Short-term acceptance of such reassurance, that is, for a few weeks during or immediately after investigations, does not exclude this diagnosis because they will come back anyway. Somatization disorder must have at least 6 or more symptoms from the following list, with symptoms occurring in at least 2 separate groups. The first group is gastrointestinal symptoms. Now the person will complain of abdominal pain, something in the stomach is not right, is either ache or pain, and it is more persistent, more deep, and doctors cannot find it with examination. There may be nausea, feeling bloated, or they are full of gas. There is a bad taste in the mouth, or the tongue is excessively coated with something. Complaints of vomiting or regurgitation of food, as if the food is coming back to the food pipe from the stomach, and they feel like acidity, feeling of nausea, sickness, and even actual vomiting. Complaints of frequent and loose bowel motions or discharge of fluid from their anus. Cardiovascular system symptoms. They will complain of either breathlessness or chest pain. Genitourinary system. They will complain of dysuria, that when they go to the to wee for urine, it is hurting them. There is complaint of frequency of micturition, that they have to keep on going to the toilet for urine to pass the urine. Unpleasant sensations in or around the genitals. Complaints of unusual or copious vaginal discharges. Skin and pain symptoms. They feel that their skin is getting blotched, or there is some blotchiness or discoloration of the skin. Pain in the limbs, extremities, or even joints. Unpleasant numbness or tingling sensations in their fingers, hands, under the skin. Out of these main systems, gastrointestinal system, cardiovascular system, genitourinary system, skin and pain symptoms, minimum 2 of these groups must be present, and out of the total 14 symptoms, at least 6 symptoms must be present from 14 symptoms, and at least 2 different systems must be present, either genital, urinary, cardiovascular, gastrointestinal, skin and pain symptoms to qualify for the somatization disorder, and they must be present for 2 years. Exclusion criteria is if the person is suffering from some kind of schizophrenic illness, either schizoid personality or schizoid disorder or paranoid schizophrenia, then these should be excluded. Then they are not diagnosed with a somatization disorder. Even if they have any kind of mood disorder, severe depression, mixed anxiety and depression, then we should not diagnose with the somatization disorder. The other exclusion criteria is the panic disorder. If the panic disorder is present, we shouldn't diagnose the somatization disorder. However, somatization disorder does include multiple psychosomatic disorder. Thanks for watching. If you like this video, please press the like button, share with your friends, and subscribe the channel. I will see you again in my other videos.